Good afternoon and welcome to Trust, Seizure Recognition and First Aid. My name is Andrea Rassiopi and I'm Vice President of Epilepsy Services for Epilepsy Services of New Jersey. If you're watching this recording live, you'll receive a certificate in your email tomorrow, and that will be evidence that you saw this training for Paul's Law. If you're watching a recording of this webinar, I suggest that you sign off with the school nurse that you did view this training. And I also have a record, as long as you registered with your email address, I have a record on my end that you participated in the webinar. This training is good for 2 years, so every 2 years you'll need to get trained in seizure recognition and first aid. Objectives for today's training are to recognize common seizure types and their possible impact on the student, know appropriate first aid for each of the types of seizures, recognize when a seizure is an emergency, and how to provide support for the student while they're having the seizure and afterwards. So what is a seizure? A seizure is the symptom. So a seizure is a brief excessive discharge of electrical activity in the brain that alters one or more of the following. We automatically think of convulsion or movement, but a seizure can also affect a person's sensation, behavior, or awareness. So what is epilepsy? Up until a recent Institute of Medicine report, we used to call epilepsy a chronic condition. We actually changed that terminology where we now call epilepsy a disease. One benefit of calling it a disease is diseases can have cures, and that's something that we strive for every day in the research community. So epilepsy is disease, and the seizure is the event or the symptom of having epilepsy. Epilepsy is defined as recurrent unprovoked seizures. So there has to be at least 2 unprovoked seizures occurring greater than 24 hours apart. In some medical forms, epilepsy might actually be referenced to as a seizure disorder. Seizure disorder and epilepsy are the same thing. Some interesting stats about epilepsy. 3 million Americans and more than 65 million people worldwide have epilepsy. 315,000 students in the United States, and then more specifically 12,000 in New Jersey. More than 45,000 new cases are diagnosed annually in children. And this is a newer stat also. We used to say 1 in 100 people will develop epilepsy in their lifetime. Now, since that Institute of Medicine report, we say 1 in 26 people will develop epilepsy at some point in their lifetime. So that's a big jump. It's really important that we see epilepsy as a spectrum disorder affecting people in many different ways. And the highest growing population of people with epilepsy are actually senior citizen population. So symptoms that might have been diagnosed as forgetfulness, old age, dementia, might actually be seizure activity. 1 in 10 people will have a seizure in their lifetime and never have another one, so they're not classified as having epilepsy. Epilepsy is more common than cerebral palsy, Parkinson's disease, muscular dystrophy, and multiple sclerosis combined. Most seizures are not medical emergencies. We don't need to call 911 every time somebody with epilepsy has a seizure. People might not be aware that they're having a seizure or might not remember what happened or what they were doing. You can't catch epilepsy by touching somebody while they're having a seizure. Although it involves the brain, epilepsy is not a form of mental illness. People almost never die or have brain damage during a seizure. There is something called SUDEP, sudden unexpected death in epilepsy. Lots of studies are going on regarding SUDEP. Doctors just don't know why some people might unfortunately pass away from SUDEP. A year or so back, Cameron Boyce, a Disney star, actually passed away from SUDEP. A person can't swallow his or her tongue during a seizure, but what can happen if the person's lying on their back during a seizure, their tongue is in a relaxed state, and the tongue might fall back and block the airways. So what we say is turn the person on their side so their tongue will fall to the side and help them breathe easier. So never put anything in someone's mouth while they're having a seizure. They can bite off whatever you put in their mouth and they can start choking. You can chip their tooth, break their jaw. Some common causes of epilepsy. So for 30% of the population of people with epilepsy, there's a known cause. So brain injury at birth, brain trauma, brain lesions. But for the other 70% of people with epilepsy, the cause is unknown or presumed to be genetic. We are now going through a classification change of some of the terminology we use for seizure type. So I will be referring to the old names and the new names. So focal onset is either aware or impaired awareness. Generalized onset is impaired awareness. And lastly, there's unknown onset. There's two types of seizures, two main types of seizures. Generalized means the whole brain is having a seizure at that time. Common types include generalized onset, non-motor, and tonic-clonic. Symptoms include convulsions, staring, muscle spasms, falls. Focal seizures only involve part of the brain. So whatever part of the brain is having a seizure at that time is what function is going to be affected. So the part of my brain that controls my speech has a focal seizure, my speech is going to be affected. There's over 20 different types of seizures. The seizures we're discussing in today's presentation are the most common. People with epilepsy can have one type of seizure or several. So just because there's a child with epilepsy in your class doesn't mean that they have convulsive seizures. They might have a different type of seizure, and we'll talk about some of those. I referred to this earlier, but I'll say it again. Epilepsy is a spectrum disorder and very specific to the person. Make sure you ask those questions. What do your seizures look like? When is it an emergency? When do I call 911? Are there any side effects of your medication? Anything else I should know? So first, we're going to be discussing generalized seizures. The first generalized seizure we're going to be talking about is generalized onset non-motor seizure. This used to be called absence, and then prior to that, petit mal. So basically, the person stares off for a couple of seconds during this type of seizure. They might make a chewing or blinking motion, usually lasts 1 to 10 seconds. For some, it can occur several to 100 times a day, may be confused with daydreaming, lack of attention, or ADD. If you were to call the person's name during this type of seizure, they won't be able to respond to you. And whatever was taught to them or told to them during those couple of seconds won't be remembered by the person. Personally, I think this is a very difficult type of seizure to have in the school system. There's really no seizure first aid, but the child could be missing out on a lot of work during the day. So it's important, if you notice this activity over a week or 2 or 3, mention something to the school nurse or the parents and ask them if they are noticing any of this activity at home, and maybe make a visit to the neurologist. The next type of generalized seizure is generalized tonic-clonic seizure, used to be called grand mal, or the TV seizure, your convulsive seizure. Generalized the whole brain, tonic is stiffening of the muscles, and clonic are your convulsions. So basically, this slide is a timeline of what happens when somebody has a generalized tonic-clonic seizure. A sudden hoarse cry as air is let out of the diaphragm, and then there's loss of consciousness. At that time, the person will fall to the ground, and then the convulsions will start. Stiffening of the arms and legs, and rhythmic jerking. So if one arm's moving, the other arm's moving. If one leg's moving, the other leg's moving. Shallow breathing and drooling might occur. Possible loss of bowel or bladder control. Occasionally, skin, nails, lips may turn blue. Generally lasts 1 to 3 minutes, and often followed by confusion, headache, soreness, tiredness, speech difficulty. This is the type of seizure you can do the most to assist the person. We at Epilepsy Services in New Jersey came up with an acronym, and the acronym is TRUST. Each step will help you to remember what to do. The first T is turn the person on their side, and we discussed that earlier. The tongue will fall to the side and help them breathe easier. Also, if there's any vomiting at the end of the seizure, they'll be in a good position for that also. R is remove all objects in the person's glasses if they have glasses on. Anything that the person can touch or is in their arms or legs length, they can bang into and it can fall on them and hurt them. I also like to say remove unnecessary people, because there's no reason for 20 people to watch somebody have a generalized tonic-clonic seizure. U is to use something soft under the person's head, a pillow, a blanket, a sweatshirt. If you don't have any of those things, just take your hand and put it under the person's head and stop it from hitting the ground. S is definitely easier said than done. Stay calm and stay with the person. You just want to make sure that this person is safe during this time, and you want to make sure that you're really setting the tone for the rest of the kids in the class to stay calm. T is time the seizure. Generally, for people that have generalized tonic-clonic seizures, it's an emergency if it goes over 5 minutes, but that can vary from person to person, so it's important to know when it is an emergency. Dangerous first aid: never put anything in someone's mouth during a seizure. Never hold down or restrain the person. You can hurt them, and holding them won't lessen the seizure by any amount of time. Don't attempt to give oral medications, food, or drink during a seizure. So when is a seizure a medical emergency? A first-time seizure, so it's someone that you don't know and you don't know their history, or it's a family member and you know they've never had a seizure before. That's a medical emergency. Convulsive seizure lasting more than 5 minutes unless otherwise noted. Repeated seizures without regaining consciousness, so one after another. More seizures than usual or change in type. So if someone usually has the staring seizures and one day has a convulsive seizure, that's cause for concern. Person is injured, has diabetes, or is pregnant, or seizure occurs in water. We just don't know how much water that person might have swallowed. Next, we're going to be discussing focal seizures. The first is focal onset aware seizure, or what used to be called simple partial seizure. During this type of seizure, there's full awareness is maintained. I could be having a focal onset aware seizure right now, and you would never even know. I could continue presenting to you, answering your questions, conversing with you, and walking around or even driving. So think of it, whatever part of the brain is having a focal onset aware seizure at that time is what function is going to be affected. So rhythmic movement, the part of my brain that controls my right hand has a focal onset aware seizure. My right hand might twitch. Sensory symptoms, I might feel tingling, weakness, hear something, have a funny smell in my nose, funny taste in my mouth, feeling of upset stomach, or visual distortions. Psychic symptoms, deja vu, hallucinations, a feeling of fear or anxiety, or a feeling I just can't explain. Usually lasts less than 1 minute and may be confused with acting out. You might be familiar with the term aura. Aura was always known as the warning before somebody was about to have a seizure. An aura is actually a focal onset aware seizure. So for some individuals, they know that they get that funny smell in their nose for a couple of seconds and then it goes away. Others know that when they get that funny smell in their nose, that is a precursor to a seizure where awareness might be altered, and that allows them time to prepare. So focal onset impaired awareness seizure is very different. It used to be called complex partial. So during this type of focal seizure, awareness is impaired and there's an inability to respond. So it usually begins with a blank, dazed stare, and then the automatisms will start. These repetitive, nonsensical movements, clumsy, disoriented movements. The person might be wandering, picking things up, nonsensical speech. So what they're saying, they can talk, they can walk, but what they're saying doesn't make sense to the situation they're in, or where they're going doesn't really make sense. They're just walking around in circles maybe, or lip smacking. Often lasts 1 to 3 minutes. It can be followed by tiredness, headache, or nausea, maybe combative if restrained. So it's important that you never restrain somebody that has a focal onset impaired awareness seizure. And unfortunately, it's very hard to detect. So maybe confused with drunkenness or drug abuse or aggressive behavior.